My name is Sauli. I'm a pediatrician, a pediatric oncologist, and I come from Tampere, Finland. I've been working with pediatric clinical trials for quite a while. I'm especially interested in medicinal products in children, and not only the medicinal products, but delivering them. So that's why I'm really enthusiastic in doing research with this new product. I've been conducting research in childhood leukemia, and that's why I would like to say a couple of words about leukemia in children before I go on with lumbar punctures. And I'll talk about lumbar punctures, how they're performed, and how to improve the techniques in lumbar punctures. First, if we have a look at the history of the treatment of leukemia in children. As you can see, the curves here present the survival rate in childhood leukemia in different decades, or as time goes by from the 60s to the 20th century. As you can see, we're doing quite well nowadays. The survival rate is quite good, but still there's place for improvement. Approximately 5% of the children don't survive, and that's why we need research. These curves tell about the situation in the Nordic countries, since we've had Nordic collaboration in leukemia treatment and research that has been really fruitful. But the curves are similar as the previous ones. We still have approximately 5% that need more or better treatment to survive. The improvement for these kids, it's not only chemotherapy, but I think one potential improvement would be reducing the number of central nervous system leukemia. What's the role in lumbar punctures in the treatment of leukemia? Of course, we need the puncture to detect cancer cells in the cerebrospinal fluid. And then, of course, we need to administer the treatment to the central nervous system, which is really well protected from the rest of the bloodstream. So the procedure itself requires some knowledge. You have to know the anatomy of the structures surrounding the cerebrospinal fluid. You have to know the most efficient position of the patient to perform the procedure. Most often, older children are lying down, while smaller kids, infants, are in a sitting position. There are certain structures you should not you should avoid doing or you shouldn't do injury in the structure surrounding the cerebrospinal fluid. When thinking of leukemia and the origin of the leukemia cells in the bloodstream, of course, you should avoid puncturing the veins. One potential injury site would be behind, or if you puncture too deep and hit the veins here. So this is how we do it. This is just a video of how we've been doing this. This has been recorded in Sweden 5 years ago. So first you have to palpate the position of the puncture site. Of course, it requires knowledge of the site and the surrounding. You need experience to perform this. And you really don't know when you're there if you're not experienced. The way you know you're deep enough is when you see the fluid running out from the needle. But would it be possible to know this without taking the mantrine out of the needle? One special point in the treatment of leukemia is the fact that when performing the lumbar puncture, you have to see whether there is blood in the fluid or not. If you have blood in the cerebrospinal fluid in the diagnostic puncture, the child receives a more extensive therapy. So it's not only giving the therapy, but avoiding extra therapy or extra toxicity. We performed a study here in Finland in the 5 university hospitals in Finland with the new IQ needle. We registered the success rates, and of course we had a look at the traumatic taps. One important finding was a rather low rate of post-puncture headache. When comparing the results with the literature, the headache rate was significantly lower. According to this trial, we think, or we came to the conclusion that this new device would help in this patient group. When we're doing well, it's difficult to improve the good results. One way, in my view, is to improve the treatment of CNS leukemia. This image here is created by AI. I asked AI to create an image of improving the CNS leukemia treatment. I also asked about improving techniques in lumbar punctures. There were lots of things considering the techniques, but the most important, or the conclusion, is stated here. We need adequate training, we need feedback, and we need competence. I thought about the same things a couple of years ago when reading a paper about younger colleagues not being competent in performing lumbar punctures. I thought that perhaps this new device could help in training medical students in performing lumbar punctures. So we conducted a study. The yellow bars are with conventional needles, while the blue bars are with the new needle. The medical students received equal training. They had no earlier experience in performing a lumbar punctures. They succeeded with the puncture more often and with fewer number of stylet removals with the novel device. We asked the medical students how they felt about using the new spinal needle, and again the colors are same: yellow for conventional needle and blue for the new device. They felt it was easy to learn how to use the needle. They found themselves confident while performing the lumbar puncture. As a whole, they had a positive feeling, even though they did not have any experience earlier. So my conclusion was that these medical students got the help or benefit from this new device, and in clinical practice we need to do things without very much experience. So this is helpful. We are planning more research with the needles to find out whether or not it helps in clinical practice. Thank you. I think this is all I had to say this time.